Hi, my name is Dr. Sanjeev Bagga, and I will be talking about the role of F-Dopa in the diagnosis of Parkinsonism syndrome. The MRI images on the left and the graphic on the right demonstrate caudate head and the putamen. F18 fluorodopa is used to visualize the dopaminergic nerve terminals in the striatum. This test is used to assess dopamine activity in the brain. Fluorodopa PET supplements clinical evaluation. Dopamine, a neurotransmitter, is involved in movement control, mood regulation, and reward processing. The recommended adult dose is 5 millicuries of F18 F-Dopa IV infused over 1 minute. The patient is encouraged to drink a lot of fluids and encouraged to avoid 70 minutes after injection and frequently after imaging. Imaging starts 80 minutes after administration with a 9-second CT scan for attenuation correction and then a 3D PET scan from 80 to 100 minutes post administration of IV F-Dopa is performed. Patient takes 150 mg of carbidopa by mouth 1 to 2 hours before IV F18 fluorodopa injection. Carbidopa increases the uptake of fluorodopa in the brain by preventing its breakdown or decarboxylation. Ideally, patients should discontinue all Parkinson's medications 12 hours before fluorodopa injection. I will give more details later. Critical organ for this examination is the urinary bladder. The patient is encouraged to ward as frequently as possible and to avoid 70 minutes after injection and before imaging, and as often as possible after imaging. F-Dopa scans are interpreted visually. Look at the shape of the putamen and caudate of the striatum. Optimum interpretation. Look at the axial slices parallel to the anterior commissure posterior commissure line. sagittal T1 weighted images of the brain showing a line passing through the superior edge of the anterior commissure and the inferior edge of this posterior commissure. Interpretation of the F-Dopa study requires assessment of the shape and intensity of the striatum. This is a normal scan which shows symmetric uniform uptake in the caudate and putamen, which looks like a crescent or a comma shape. On the three images that are shown here, there is asymmetric uptake in the putamen, normal on one side, which is the right side, and reduce on the opposite, that is the left side, especially in the posterior part. In the second image, which is in the middle, the uptake is bilaterally reduced in the putamen, and in the right image, the DOPA uptake is bilaterally reduced in the putamen and in the caudate nuclei. Prior to floor-dopa injection, the use of AADC inhibitors like carbidopa and penserazide, they increase floor-dopa bioavailability to the brain by inhibiting peripheral decarboxylase activity and restricting peripheral floor-dopa F-18 metabolism. Floor-dopa is cleared from the blood and tissues within 24 hours. F-Dopa injection, use of aromatic L-amino acid decarboxylase or AADC inhibitors like carbidopa and benserazide may increase F-Dopa availability to the brain by inhibiting peripheral decarboxylase activity and restricting peripheral F-Dopa metabolism. Therapy for Parkinson's syndromes includes dopamine agonists, dopamine reuptake inhibitors, dopamine releasing agents like psychostimulants of the amphetamine class, peripheral catechol O methyltransferase or COMT inhibitors, and monoamine oxidase or MAO inhibitors. The question to ask is discontinuation of these drugs prior to IV F-Dopa administration minimize the interference with F-Dopa imaging? This is not clearly well known. So if use of these drugs can be safely suspended, then it is better to discontinue these 12 hours before administration of F-Dopa injection. What are the medications that should be stopped before F-Dopa scan? These include cocaine for at least 1 day, dextroamphetamine for 2 days, methylamphetamine for 1 day, phentermine 5 days, ephedrine 1 day, methylphenidate 1 day, dexamethylphenidate 1 day, modafinil 3 days, opioid fentanyl for 2 days, and codeine for 1 day.